Well, hello, everyone. Uh, since we are talking about healthcare technology for our topic this week, as well as numerous uses of telemedicine, I've invited a guest speaker with us today, Amy Skelton, who's going to be talking to us about her experience with telemedicine in several different situations with both her previous employment as well as her current employment. So thank you very much, Amy, for being with us today. So tell us a little bit about, what you've done, what you're doing now, and what your experience has been with the use of telemedicine. Because I think, we were just talking prior to this that, it's going to become the new norm. It's become very popular during the pandemic. So I see we're going to see a huge growth in the use of telemedicine. So if you want to share with us a little bit about your experience, that would be great.
Thanks for having me, Gail. You are spot on. Telemedicine has been growing over the last several years and is only going to continue to grow. With the COVID pandemic, it has become a huge way of actually assessing the folks that even have COVID and determining
Mm-hmm.
those people and treating and assessing them. And for me personally, I started with telemedicine actually when I worked in the ICU several years ago. I worked at a facility that was about 15 miles from the mother hospital, or from the
Mm-hmm.
larger trauma center, and so the primary physicians were there. And so if we needed assessment of our patient, there was a TV on the wall, and we actually could push a button, and the
Mm-hmm.
physician could actually remote in and see our patients and help us assess the situation. So that was my first experience with telemedicine, and that was back in 2010. And so it's only grown since then. On my former job that I left in April, I actually was the director of nursing at a nursing facility for geriatrics, elderly people, where we actually did psychiatric care for the elderly population, where they could see a psychiatrist and a nurse practitioner and get counseling and get psychiatry care via telemedicine. This allowed them to stay in their environment where they were comfortable. They
Mm-hmm.
didn't have to go to the doctor's office. They didn't have to be transported out of the environment that was unfamiliar to them. Um, and still receive care. And I was amazed how well that system worked. They talked just like you and I are sitting here talking to a computer screen, like the person was in the room with them. And that program continues to grow and allows those folks that otherwise wouldn't be able to receive those services, um, and allows that population that is underserved
Absolutely.
in getting psychiatric care, to be served and to be cared for in that way. There are not enough geriatric psychiatrists to go around. Here in Iowa, that is a huge need. That is a huge underserved population. And so one physician can't see all those people. And so that allows them to see many more people in a day
Mm-hmm.
by doing it over the computer. So in my current position, I actually am a home infusion coordinator, liaison. And so I actually help coordinate before somebody leaves the hospital, or actually without ever leaving their house, either IV therapy or tube feeding, enteral feeding. And so, for example, I had a guy yesterday that had an infected joint. He had had a knee replacement. It got infected.
Mm-hmm.
He didn't need to be in the hospital. So actually, the doctor just had him go into the outpatient radiology, got an IV put in, and then over the computer, I taught him how to give himself IV antibiotics. And so for the next 6 weeks at his house, he's going to give himself IV antibiotics. But he didn't have to go to the hospital. So it saved him getting
Absolutely.
exposed to other things at the hospital. It saved him and his insurance company cost. and it saved him that mental and just physical fatigue of being in the hospital. Yes, there are times that you can't avoid that hospital, but if we can, great. So
Can you
telemedicine
imagine
is
6 weeks of
right,
6 weeks
right,
of TV therapy in the
exactly. Yeah.
hospital?
It's just
Yeah.
amazing what you use telemedicine for.
Well, good. So, kind of going back to your work on telemedicine for geriatric patients
Yeah.
for mental health care, um, we were fortunate to have you come in last year as a guest speaker. And I was reviewing your PowerPoint, and you can correct me if I'm wrong, but when you're looking at, we're discussing the shortage of providers in all disciplines.
Mhm.
But I think I saw where there were only like 6 geriatric psychiatrists in the whole entire state.
Mhm.
And when I looked at that, I'm like, oh my goodness.
Yes.
Not only is, physicians, medical physicians a shortage, we're also seeing a shortage of geriatric psychiatrists as well. So when that patient or your resident sets up this appointment, what is the setting like, to make sure that, I think a lot of the concerns with using telemedicine is with HIPAA and with privacy,
Mhm.
and not having this confidential information being out there on the web,
Mhm. Mhm.
somewhere. So how did you, one thing that I did have a question about was how do you ensure like
Mhm. Mhm.
confidentiality and the privacy of those patients?
Mhm. Yeah. And everything is encrypted. Everything has to be
Mhm.
through a secure line. In fact, the equipment that we used, that was only the only thing that we could log into was the secure website. And we actually used a HIPAA compliant software. So we didn't use Zoom like you and I are using
Right,
now.
because it's
Where that could be accessed by somebody else. We used something that was set up specifically for telemedicine that is HIPAA compliant, that's been run through the testing and through the encryption, that can't be accessed from the outside world. And actually, that's an interesting point. We actually had a dementia patient that had a little bit of psychosis that was concerned that actually we were sending that out through
Mhm.
the phone line, that it had been recorded, and so that took some convincing that to him that that was not happening, and so that he was concerned about that. But there's there's safety measures in place, and so the environment that they're actually in is either their own resident room, or we actually had a space set up that we used as like an exam room, but they could choose whether they wanted to go to that space or to do it in their own room, and we just used a laptop that was portable that could be used, but it's very specific software that's intended for that purpose only.
Right. I mean, I think it would be so beneficial for those residents to be in their safe place where they, they're comfortable and
Mhm.
not having to endure the stress of being transported and all those
Yeah.
types of things.
Mhm.
And I think it's been, what, about 5 years since that initiative began. So hopefully you've got some data coming in.
Mhm.
So how has it improved not only access to mental health services, but also, with the, with their condition as well? Have you seen some type of improvements, or what does that preliminary data look like?
Mhm. Several of the things that we always track are medication use, and
Oh
we've seen
yeah.
a reduction in the use of medication
Mhm.
with the access to services, and the other thing that we monitor both for the facilities use as well as for the physician's use is behaviors, and that obviously fluctuates, situationally, seasonally. There's a lot of environmentally, there's a lot of factors. But we would see a variance of that as well, going up and down. But I would say overall there's been an improvement as we learn things, as we put strategies from the experts, from these physicians and nurse practitioners, that this is their forte, this is their expertise that can assist and help, in the care of these people.
Well, that's great.
Yeah.
And like we were saying earlier, I think telemedicine will become the new norm.
Mm-hmm.
And, there used to be, especially for mental health services, there would be waiting lists for 6 months to a year. And when you're suffering from acute mental distress, it's like, I don't know if I can really wait a whole year. So
Right.
telemedicine just allows you to
Right.
see more patients and really increase that access.
The last time that I had checked to get into the geropsych clinic was about a 6-month wait, and we can get appointments usually within a week or two.
Oh,
Yeah, so
that's
big difference
awesome.
there.
Yeah, absolutely.
Yeah.
Um, so I know you're swamped. We'll just kind of keep this brief, but many of the students who are viewing this
Mhm.
are interested in going into all sorts of different disciplines within health services, whether it's physician, a PA, nurse practitioner, nursing, public health, administration. So, do you have any words of wisdom, or since it will probably become much more common than we have seen even a year ago.
Mhm.
So how can they get experience with the use of telemedicine? I'm sure many of them already have, but since it will become more common, is there anything that you would like to share with the students about how maybe they can kind of get some experience or learn a little bit more about telemedicine?
Mhm. If you currently are working somewhere, ask the company you're working for if they use telemedicine, and if you would be able to observe that or participate in any of those sessions, or if there's opportunity to even just see how it works, so that you get some experience with it. If you're not currently working somewhere, the university's got amazing telemedicine opportunities. Ask around, talk to some different people there. There's a wide variety of telemedicine opportunities there, and in both, like you said, both medical as well as administratively. It's out there, and it's being used in all varieties. My husband works in the banking industry, and
Mhm.
it's being used in every facet of our lives, and it's out there, and I would really encourage them to ask, because that's how you're going to get the opportunity.
Okay. Well, thank you so much, Amy, for spending time with us today. And you take care.
Yes, thank you.
Thank you.